who gets hurt from, you said you've looked at, in a couple of the dates, you said you've looked through the budget, you've identified areas that you believe with their consolidations, spending cuts, reductions, et cetera. Who gets hurt with your plan?
Well, first of all, I think that we need to reduce expenses at least $2 billion a year. The additional $1.5 billion, we've missed 3 opportunities this year to get significant grants out of our federal government. For every dollar we send to Washington, we only get 62 cents back. We can get more. And this government has not worked hard enough to get more money out of Washington, and these are 3 good examples. We missed 2 education grants and 1 transportation grant. Altogether, there were about $600 million potentially, and we got 0. Well, when I'm governor, we'll get those $600 million. So I'm saying maybe $500 million more coming from the federal government, and $1 billion we can get by beating the forecast that's in the budget on the economy and revenues that come from economic activity, sales tax, income tax, etc. If we can restore 50,000 jobs within 18 months, we will create, according to economic projections, an additional $1 billion of revenue. I think I can do that, and I don't think my opponent can, because I actually have a plan. So,
but you've got 6 months to take care of a $3.5 billion deficit right off the bat. In that $2 billion that you think you can save, how deep does that go? I mean, everyone talks about the pain, but no one really talks.
Well, let's talk about some of them.
Yeah.
Okay. One of them is we have one of the most expensive healthcare systems in the country, in Connecticut, and we need to lower the cost of delivering healthcare services. I'm not talking about lowering benefits, but the cost of delivering a healthcare benefit to someone. It's $30 billion worth of our budget. It's $30 billion worth of our GDP. It's $7 billion, or a third of our budget. If we can bring down healthcare costs 10%, which is what the front end of Obamacare was supposed to deliver, it wasn't ever passed. But this is wellness programs, electronic record keeping, tort reform, more managed care frameworks, getting away from fee-for-service healthcare. That they estimated that they could drop national healthcare costs 10 to 15%. We're one of the highest cost providers, so we should be able to do even better than that. But if we only do 10%, that will save the state government $700 million. Okay, so we're a third of the way there.
And no one loses any benefit. Nobody.
No, that's not a change in benefits. That's just if you have a heart attack and you have to go to the hospital, the cost of providing that care costs 10% less. There's a lot of government policy that can affect this. For example, a lot of people, particularly people who don't have insurance, tend to go to emergency rooms for primary care. Very expensive way to provide primary care. So if we can transition people to a primary care physician for non-emergency care, it saves a lot of money. We have a very expensive Medicaid system where our elderly Medicaid patients are really on a fee-for-service, not a managed care framework. A lot of them are in nursing homes. Too many of them are in nursing homes. Many of them would benefit from community-based care. It's more humane. It keeps people closer to their families and their friends, and it's a lot less expensive. If we could get 25% of our elderly Medicaid patients into community-based care and out of nursing homes, or not going into nursing homes, which is where California and Oregon are, we could save maybe as much as $500 million a year. Now, half of that has to go back to the federal government because they subsidize 50%, but that's $250 million. We have far too many people incarcerated in our state. We have a lot of nonviolent criminals who are in prisons, and there are much less expensive and just as effective alternative sources of punishment that don't involve incarceration and also don't present a public safety risk. We should be moving in that direction. That saves money. We have the Thomas Commission and the Hall-Harper Commission, which made recommendations for how we could streamline government and eliminate waste. very few of those recommendations was ever implemented. We should implement them. People say you could save up to $200 million on those alone. We need to look at services that the state is providing that could be provided less expensively through private contractors. And I'm committed, I represent the shareholders, I mean the taxpayers in who are basically the shareholders in our state government and our state, in making sure that we get the best deal for them in the services we're buying. Our state requires that if we go out to get a private contractor to pave a road, for example, that we get the best deal that's available to the state. Somebody who meets the minimum quality standard required, and we'll do it for the lowest price. But we don't impose that same rigor on the state government itself. And I'll represent taxpayers up there. If the state government's going to pave a road, we're going to look at what that costs, and if a private contractor can do it for less, we'll move to the private contractor. So we're going to look at all the services that the state provides directly, and if private contractors can provide it for less, we're going to move to private contractors. Now people say, oh, well, we'll have people out in the street. No, because those private contractors need people to provide those services. So when this has happened in the past, if work transitioned from state government to private contractors, usually the state workers who were providing those services end up getting hired by the private contractors, and at probably more competitive pay and more competitive benefits. So they will lose something, but they won't lose their jobs. But they'll be paid like people are in the private sector, who are now earning far less in current compensation and far less in benefits than state workers do. State workers now are paid a premium for the same work, and the benefits are 60% of payroll, as opposed to 25 to 30%, which would be typical in a private sector company that had very generous benefits.
So basically, I'm going to sum this up. You see the opportunities in this budget to reduce state spending, save the taxpayers money, without causing any real harm to the services and the programs that Connecticut citizens rely upon.
Certainly what I consider critical programs and services. Yeah, we can do this without harming our most needy citizens. I've made the commitment to do it without lowering the amount of support we provide to towns and cities for education, which I consider a critical investment in the future. Yeah, so the answer is yes.
Okay.
I mean, let me give you an example. There was an article last week about 2 state workers' cell phones that had been lost, and we paid $31,000 in bills over 8 months before anybody figured out that these had been lost, and somebody was running up large bills on these cell phones. That kind of stuff won't happen in the Foley administration. Somebody's asleep at the switch when things like that are going on. So there's a tremendous amount of waste in our state government, and we just need to eliminate it.
Let me talk about one of the state agencies and get your thoughts on that, DCF. For all practical purposes, I think it's safe to say that that's a nightmare. How versed have you made yourself about what's going on over there and what you're planning?
Yeah. I've heard a lot of people complain, including people who are currently employed in DCF and others who have been employed there in the past. As you know, the federal government doesn't think we're doing enough, and a judge has recently confirmed that they don't think we're ready to take the training wheels off yet and ride the bicycle ourselves. And so I take them at their word, and so I assume there is a problem there. I have not looked into specific policy initiatives we would take in DCF to correct the problem, but one of the things that a governor does and can do and should do is for all the state agencies to appoint competent and experienced commissioners. And too many times commissioners and other people at the senior level of state government within the agencies, they're political appointments, they're patronage appointments, and people are put in these jobs who who don't have the management experience, don't have the leadership experience, and don't understand good policy and good government within the agencies that they're serving. So I'll get the best and brightest people we have with the right skill sets and experience to run all the agencies, but particularly at DCF, where I think we recognize that there's a challenge. We need somebody who's a reformer, who's has the right skills and experience to do the analysis, understand what we're not doing right, where we need to go, and how we're going to get there. And I will support that person.
Are you in a position at this point that you feel like you understand that issue enough to say, by the end of my 4-year term, we will be off that federal supervision?
That would certainly be a goal.
Have you decided yet? I mean, I realize it's premature, you have to win the election first, but how much thought are you giving to this team of commissioners that you will be appointing who have to hit the ground running in a
Right.
very difficult start?
Well, the next governor's going to have from November 3rd until January 5th to prepare. Now, I've been preparing since last spring, and I'm not in any way being presumptuous about whether or not I'm going to win. But November 3rd to January 5th is not a long enough time to staff a government, prepare a budget, and start implementing the policies that we need to turn the state around. So I've had policy teams in place since late in the spring, and they've been recommending policy and including, they've been recommending candidates for senior level positions in the departments. I've made no choices, no decisions, and won't until November 3rd. But I'm not waiting until November 3rd to start the process. I'll be prepared to make some critical decisions right away.
Back to the budget plan, where part of your plan is contingent upon, within 18 months, getting those jobs and getting that economy back up again. I'll ask you the question that I asked you here last time, where you were kind enough to tell me I was the only one who's ever brought the issue up for you. The unemployment fund. It's a problem come January 5th when you take office. I'm guessing there's going to be 1 or 2 people still unemployed in this state, and they're going to be looking for a benefit check, and there's no money to pay them.
Right.
It's not in the budget, it's an off-budget issue.
Yep.
So if you move it into the budget, you only make that worse.
Sure.
So the only other source of money keeping it out of the budget is that unemployment tax. And if the state doesn't act, the feds will come in and they will act. And they'll put a rate on that will hurt business, and there goes your 50,000 jobs. Or am I wrong?
Well, I don't know about 50,000 jobs, but it is one thing that makes it more expensive to employ people here in Connecticut. Our unemployment insurance is higher than most states, including the neighboring states. And we need to figure out a solution to that problem. But listen, we have a lot of problems that are at least as big as that.
But that one's an immediate one. I mean, that one needs to be addressed right off the bat by your administration. Otherwise, the feds do come on in. So at the very least, there needs to be a plan.
Well, we need front and center on the first several weeks of being a new governor. You have to have the whole budget figured out, make a budget proposal to the legislature. So it's part of the mix. But do I know the answer right now? No. Will I know the answer on January 5th? Yes.
Your plan for education, you're taking some hits from critics who basically say you're not looking at or giving enough attention to pre-K statewide. Are they right?
Well, no, they're not. I have just visited. We have Head Start, obviously, and we